Good morning. Welcome back here at ESCMID Global TV. I am your TV host here, Judith Cohen, and I'm very pleased to have all you back here with me in the studio, but even more pleased to have with me in the studio here one of the keynote speakers at this year's ESCMID Global, Dr. Jeanne Marrazzo, who is an infectious diseases specialist and last year was appointed as the director of the NIH's National Institute of Allergy and Infectious Diseases. And today we'll be holding a keynote scientific interview followed by a fireplace session on the topic of syndemic of HIV and STIs. So a warm welcome to you, Jeannie. Thank you so much for taking the time or finding the time in this busy Congress to join us and give our viewers just a little bit more details on what we'll be discussing your keynote scientific interview, which is today, I believe, just after lunch at 1:30. So HIV has been your research interest for quite some years already, I believe.
It has. So I got into the field of HIV as a very young trainee in the days before there was effective antiretroviral therapy. And in those days, it really was a death sentence for most people. So a lot of us in training at that time were very much committed to trying to make a difference and take care of very vulnerable and marginalized populations at that time. Also, it was an entree for many people into global health because, of course, the pandemic was so prominent, particularly in sub-Saharan Africa. So huge reason to get into it. And it's been amazing to see the field evolve over the last couple of decades.
What would you say is the largest evolvement that you've experienced? Is it
Well,
the coming of therapeutics?
yeah, I mean,
Or prophylaxis?
it's pretty remarkable after living through those early days that you can tell a person who's recently acquired HIV that they can expect to live a normal lifespan, of the lifespan of a person without HIV. That was kind of unimaginable back when I was an intern or a trainee. So hard to overemphasize the impact that's had.
Do you feel that message is widespread, that people know that it's not a death sentence anymore? Or is there still in many parts of the world the taboo that if you have HIV that life as you knew it will be over?
Absolutely. The biggest enemy of our ability to control HIV is persistent stigma. So there are many places where acquiring HIV is viewed as a badge of dishonor, a shame, a disgrace, unfortunately, for various reasons. And that really prevents people from getting effective tools so that they don't get HIV. For example, pre-exposure prophylaxis. You can take a pill every day, probably even less, and not get infected, even if you are exposed sexually or otherwise. So, being able to access those tools requires that you know that you are at risk and you can admit that. And that's a barrier in many parts of the world.
Yeah. Are there even in other fields of infectious diseases, are there such strong, efficacious prophylactics available as there is for HIV, or is this really a unique
No,
situation?
absolutely not. So chemoprophylaxis, you know it probably well if you travel for malaria. If you go to a tropical country, you often will take a malaria medication. Sometimes you'll take other antibiotics for prophylaxis. But malaria is probably the best example, and we've known about that for a long time. And this is really very similar, just getting enough drug in your body so that if you encounter the pathogen, it's going to take it out. Essentially, that's what's happening.
Yeah. So, you're going to be talking today in a keynote scientific interview, and it's followed by a fireplace session. So maybe for our viewers who don't know what it is, it's actually an opportunity for a younger scientist to really get in touch with you around the fireplace.
The metaphorical fireplace.
Well, I'm not sure, but I think I saw like some sort of paper flames.
Okay, good.
So I think they recreated a real fireplace. But so you really have the chance to interact with young scientists who are also interested in this field of expertise. What are you hoping to find for you? Because I know they'll be thrilled to have a chance to spar with you on their topic.
Well, This is a huge passion of mine. I have spent a lot of my more senior professional career mentoring folks, everybody
Mm.
from undergraduate students to medical students to PhD students to infectious disease trainees. And I feel very strongly that if we don't have a next generation to continue this work, then we haven't really done our job.
Yeah.
There are lots of people who really never want to retire. I'm not one of them. I can't wait to, I mean, I don't want to retire right now, but I'm really excited to be able to hand the reins over to people
Yeah.
who care as
Yeah.
much as I do about
Yeah.
some of these issues. So I find it incredibly invigorating to be around young people who also will challenge my ideas, which are now kind of old, right?
Yeah.
So we really need those people to sort of say, you know what, I don't think that's going to work anymore. We are different. We're working differently. We're thinking differently. So that's what I hope to get out of it, which
Yeah.
is
You
really
don't find
fun.
it hard to hand over the reins and see
No,
maybe potentially see them taking the research in a direction that you wouldn't want it
never
to go?
ever
No.
have, never have, because things change. Everything
Yeah.
changes, and
Absolutely.
also I've seen the effects of not getting out of the way and creating room for people to
Mm.
grow into leadership positions. That
Yeah.
is a really big problem. If we can't create opportunities for young people to, grow
Absolutely.
professionally and become leaders and sort of start experiencing what some of those challenges are like,
Yeah.
then, by the time they get to be my age, they really haven't matured in a way that they need to. And I see that actually, frankly, a lot.
Yeah.
So,
Yeah.
yeah,
Yeah.
so we'll see.
Yeah. So on the topic, it's on the syndemic
Hmm.
of HIV
Hmm.
and STIs because they are co-travelers, right?
They are co-travelers.
What will you be talking about? A little more
So,
detail. Don't have to spoil the whole talk, of
no, I don't
course.
think there'll be any giant plot spoilers. I think what I'm going to talk a little bit about is the fact that the fields for a long time were very distinct.
Mm.
So HIV people, and I say this having straddled both worlds for a really long time, people who were studying HIV were often very interested in the virus. They were interested in the pathogenesis. They were interested in the medications. They were interested very much in vaccines. They weren't so interested in that messy sex transmission stuff, because that traditionally was a field where people looked at things like gonorrhea, chlamydia, herpes, HPV. So it's taken a while, I would say, for the fields to come together, and for STIs to get some of the respect they deserve as pathogens in their own right in terms of being studied for some of the things that people who studied HIV were interested in.
Yeah.
So I think, and we're now also seeing this endemic epidemiologically in that people with HIV, living with HIV, again, are living longer. They're having healthy sexual lives, and so we're seeing a lot of STIs in that population. And then the last piece is, of course, people who don't have HIV but have an STI often are at increased risk for getting HIV because
Yeah.
STIs create a very receptive environment for the virus to infect people. So basically, because of inflammation or other things going on in the genital tract.
Yeah.
So I think it's
So is there
mostly
also an
about that.
increase in STIs being seen? Well, of course it depends in which country we're talking about,
Yeah,
but
there's.
um,
Why are we seeing an increase in STIs?
yeah.
I think part of it is that we have fallen way behind on our prevention tools. So we
Is it because we're not scared of HIV anymore?
absolutely, I think that's a big problem. Problem, opportunity. I mean, what is it? It depends on your perspective.
Yeah, it's a good thing we're not
Um,
scared of it anymore, of course.
Absolutely.
Yeah.
When you have
Yeah.
something that can essentially um, prevent you from transmitting HIV without using a condom, which is frankly a goal for many people, particularly around using PrEP, it's excellent because you're not going to transmit HIV, but you are definitely going to remain at risk for syphilis, chlamydia, gonorrhea, all those other friends,
Yeah.
fellow travelers.
Yeah.
There's a lot of debate about whether that is a close relationship, i.e., the increase in HIV pre-exposure prophylaxis and the increase in sexually transmitted infections. You can sort of argue it both ways, but my opinion is that they're closely linked.
Yeah. So the STIs are also susceptible to AMR, antimicrobial
Very much
resistance.
so. Hmm.
Does that also increase the risk of a co-infection with HIV, for example?
It can, in that there's probably not a direct relationship, but if you can't treat the STI, you're going to have persistent inflammation in the genital tract, which is a big risk factor
Yeah.
for, again, when you have inflammation, you have immune cells there that are very ready for HIV to infect. So conceivably that could be an issue. I think with AMR, the two things that we're most concerned about are gonorrhea and mycoplasma genitalium. Both are, particularly gonorrhea, independent risk factors for acquiring HIV. So if you do acquire resistant gonorrhea, it could definitely be associated.
Yeah. Yeah. So those two are the ones that also have the largest problem with AMR.
Yes,
Is that correct? Okay.
yes. So for
Yeah. Yeah.
gonorrhea, for example, which I will talk about, again, no spoilers here, we are down, even in the sort of industrialized Western world, to one antibiotic to treat it, and it's given as an injection.
Yeah.
So we really have, we have a pill that works, but is not first therapy. It's not the best therapy. And in many places, particularly in Asian countries, we're seeing resistance even to that last line drug.
Yeah.
So it is not a good situation, I
No.
would say. Not a good
So
situation.
is the problem there that there's just not enough therapeutic agents? Because I can hardly imagine that it's due to inappropriate antibiotic use, or is that also related in this situation?
Not so much with gonorrhea. It's more that it's
No.
evaded everything over
Yeah.
the last 100 years. I mean,
Exactly.
it just literally every 10 years, every 20 years, you lose a class of drugs
Yeah.
because it just gets resistant.
Yeah.
So I think, and we have managed to hang on to this one class
Yeah.
now for quite some time, about 30 years. Hopefully that will continue. I don't think it will, based on the signals that we're seeing. We do have some hope. We have a couple of new agents that are probably going to be approved and move forward in the next couple of years, and those are pills. But
For
it
gonorrhea.
takes for gonorrhea.
Yeah.
But it's not exactly a lucrative market, right? It's not a, and that's one of the big
That would be
problems
my
with
next
AMR.
question.
Yeah.
That they're underrepresented probably in the whole pipeline antibiotic
Absolutely.
agents.
I mean, this is not
Yeah.
like a weight loss drug or a
No.
cancer drug,
No.
or
No.
it's whoever makes these drugs is doing a service to humanity, but not necessarily doing a service to their financial portfolio.
Yeah.
So that's really where you have to think about creative ways to get these products through the pipeline and onto the market. And I'll talk a little bit today about the public-private partnerships that I think have nicely modeled that.
Yeah.
So that's really important for these sort of drugs that are otherwise just never going to get there.
Yeah. So what do you feel is the largest challenge at this moment within the HIV STI field? Is it the AMR or?
I would say it's up there in the top 5, but I think the most alarming thing is the increase globally in congenital syphilis. So syphilis is a disease that when I was finishing my training back when, we were on the verge of talking about eliminating it in certain populations. And in fact, at least one country, Cuba, eliminated congenital syphilis. So that's when mom transmits to baby.
Yeah.
In the US, we had a couple years where, we had a random case here or there, but it was really uncommon. In the United States last year, we had over 3,500 cases of congenital syphilis and over 260 infant deaths.
Ooh.
So and that's a trend that is being seen globally from South America to Western Europe, and that's a public health failure of enormous magnitude. We should not be seeing that. This is something that we should have really, frankly, eliminated 20 years ago. So it's a real problem.
Yeah. So prevention needs.
So what's happening
a little
here?
Freshen
It's
up.
prevention, but it's also awareness. If you can prevent congenital syphilis, you can prevent the transmission of syphilis from mom to baby by detection of syphilis during pregnancy and then treatment
So
of the
standardizing
mom.
it as a test.
It's screening. It's really screening.
Yeah.
So American
Screening
College,
every pregnant.
and I think that the Royal College, I'm not sure, recently recommended that everybody get tested 3 times during pregnancy for syphilis because of this very urgent trend.
Yeah.
So if you test everybody 3 times, you're pretty much going to get it. Thing is, prenatal screening is something we all take for granted, but isn't happening in many parts of the world for many reasons.
Yeah.
Often there are co-conditions, drug use, mental illness, all kinds of things, poor access to care, all kinds of things. So it's very tragic. It's
Yeah.
really tragic.
Yeah.
So we have a lot of work to do there.
Yeah.
So I think that's a big problem for us to talk about.
Yeah. Yeah. Is it where you will be focusing your research further on as well?
So my
Or-
research,
But you're working at the NIA right now, so your research is probably quite limited.
It is sadly,
Yeah.
but I certainly support a lot of really great research. And one of the things I'm excited about in the STI world that we have, again, when you asked about why we're doing well in HIV, but not so much in
Yeah.
STIs, a lot of work has gone into an HIV vaccine. Relative to that, almost no work has gone into vaccines against STIs until really the last sort of 10 years, 20 years for some. But, in the last couple of years, there have been some nice advances. So I'm very hopeful. Chlamydia vaccine, just a couple of nice studies out of the Danish group.
Yeah.
Gonorrhea vaccine, there are some studies ongoing
Yeah.
that are looking at whether a vaccine for a related bacteria that causes meningitis, Neisseria meningitidis, might prevent gonorrhea. And then syphilis vaccine, maybe in the next 10 years. I'm really hopeful. So people are working much harder on that with advances in, structural imaging, reverse vaccinology, development of monoclonal antibodies. So I'm hopeful that those
So
will
there
take
is
off.
awareness that there is
Oh,
still
yeah.
an unmet
Oh,
need
yes.
in the field of STI.
Absolutely.
Yeah.
There's so much
Great.
opportunity for scientists,
Yeah.
especially in immunology, who want to work on this.
Yeah.
The problem with syphilis is that it was going away, so nobody was studying it. I mean,
Yeah.
there's like a handful of people who are, especially in the basic
Who are
sciences.
experts.
Exactly.
Yeah.
Exactly. So so it's a wide open field right now for young people who want to get into it. So it's exciting.
Exciting. Well, thank
The
you
things
so
we
much.
get excited about.
Yeah, well, I can
Yeah.
imagine. Yeah. Well,
Yeah.
you need to be excited about something. Why not
Absolutely.
this?
Absolutely.
Yeah, so well, thank you so much
It's
for
my
finding
pleasure.
the time just before your big afternoon to come here and have a little chat about your scientific interview and fireplace session. I wish you a very interactive and fun and enjoyous
Thanks, Judith.
afternoon.
I appreciate it.
Thank you.
Thanks.
Thank you all for watching us. We will be back at 11 o'clock with yet another live guest here in the studio. No one less than the infectious disease specialist Sylvia Bertagnolio, who is currently the unit head of AMR at the WHO in Geneva, Switzerland. She will, amongst talk about the AMR and what the WHO activities are on that, talk to us a little bit more about the open forum that she is hosting today at 12:15 in Arena 3 on diagnostics development. So that should be really interesting. Check us out here at 11 o'clock on ESCMID Global TV. I hope to see you then.